I'm Larry Wooten. I'm president of North Carolina Farm Bureau, and I want to thank all of you that are here today at our 77th. This is our 77th screening with our Healthy Living for a Lifetime, and this is the second time that we're back in Warren County. So, and certainly, North Carolina Farm Bureau is proud of the service that we render through this program to rural citizens all across North Carolina. So thank all of you for being here. Today we're especially proud to have with us our congressman from the 1st Congressional District, Congressman G.K. Butterfield. I can tell you, ladies and gentlemen, he not only knows Warren County, but he knows agriculture. He knows Eastern North Carolina well. He is a servant of the people of the 1st Congressional District, and we really appreciate our Congressman Butterfield, for being here with us today. He grew up in Wilson. He's practiced law. He's been a Superior Court judge. He's been a member of the North Carolina Supreme Court, appointed by our governor. He served as a member of the judiciary for 15 years before he was elected to Congress in 2004. Congressman Butterfield, I can tell you, is one of our go-to people in the North Carolina delegation for the North Carolina Farm Bureau, because he's a champion of rural health care, education, investments in our rural communities. He works with our veterans, energy, federal programs that support low-income and middle-class Americans. He's just a real stalwart in the United States Congress, and he fights every day for his constituents in the 1st Congressional District and all across North Carolina. Without any further ado, I'm going to recognize Congressman G.K. Butterfield. Congressman Butterfield. Thank you.
Thank you and good morning. First, let me thank Larry Wooten and all of those who worked with him and for him with the Farm Bureau and all of the associated agencies. Thank you so very much for what you do for our communities. It is good to be back in Warren County. Larry is absolutely correct. I am no stranger to this community. I've been coming to Warrenton and Warren County most, if not all, of my life. In fact, in the early part of my legal career, my office was right here on Franklin Street in Warrenton. I practiced law with T.T. Clayton and Frank Balance many years ago, back in 1974 and 1975. And back then, there were no restaurants in Warrenton, not even a Hardee's. And so we would have to go to a little eatery right here on the corner, which was really a gas station, and get our noonday meals. But Warrenton has come a long time, a long ways, and that's due to the leadership that you have in Warren County, and just want to thank the county commissioners and the county manager and all of you who keep this county alive and well. In Congress, I serve on a committee that is called the Committee on Energy and Commerce. Well, that committee is not only concerned with energy and concerned with commerce, and certainly we are, but we are also the committee in Congress that deals with health care policy. And there's no subject that is more important to me, there's no conversation that anyone can have with me that's more important than trying to make the people in the district that I represent a healthier population. And so when U.S. Wellness and Farm Bureau and other stakeholders join hands together to create this type of health screening, not just in Warren County, but in many, many counties across North Carolina, it really warms my heart. And I want to thank you publicly for making this happen today. I am 66 years old, and that may surprise some of you. You may have thought I was older than that. Some of you may have thought I was younger, but I'm 66 years old, been living a long time. And young people, if there's any mistake that I made as a young person, was that I did not value the importance of healthy living. When I was a child, I would eat anything. I don't care what it was, fatback, hot dogs, hamburgers, you put it in pizzas. I would eat a 15-inch pizza in a minute. I didn't understand the importance of healthy living. And even though my parents were educated individuals and my father was a dentist, they really didn't understand, I don't guess they understood, the importance of really demanding that I live healthy. I didn't understand the enormous importance of recreation and exercise and all of the other things that go along with healthy living. But now we live in a new era. We live in a day where every day health departments and and all of the whole healthcare establishment. Every day they're reminding us of the importance of eating healthy and living healthy lifestyles. We have a very expensive healthcare system in this country. We talk about that all of the time, and you've certainly heard about the Affordable Care Act. Some people call it Obamacare. I happen to be a strong supporter of the Affordable Care Act. It was my committee that crafted this law 3 years ago. But one thing that we learned in crafting the Affordable Care Act is that the cost of health care is going to explode in our country unless we can contain the growth, unless we can contain the cost of health care. Insurance premiums are going up and up each year, and part of that is due to the fact that it is more expensive now to get health care, and more people are in need of health care. And with the aging of the baby boom generation, there are more and more and more American citizens who are qualifying for Medicare, and all of these new people are now coming onto the health system. And so we've got to find a way to make our health care delivery system more affordable. We cannot compromise the quality of our health care to the patient, but we've got to find ways and means of responsibly containing the cost of health care. And one of the best ways to do it is what you see today, and that is screening, going into rural communities and screening so that we can be preventive in our approach to health care. If people would just stop smoking, as an example. I'm not here today to make an anti-smoking speech, but that's just an example. That is one example. If there can be some cessation of smoking, particularly among young people. Adults may be different, but if we can talk to our young people about that and other lifestyles that are important. And so thank you very much for letting me come today. Thank you for what you do in our communities. And let's get back home and let's talk about healthy lifestyles. Thank you very much.
Congressman Butterfield, thank you for being here with us today, and thank you for your friendship. Thank you for caring about the citizens of not only the First District, but the citizens of the United States as a member of Congress, and we really appreciate you being here. Another individual that we have here with us today that we are extremely pleased that she came to be with us. She came from Washington, and that's Mary Greeley. Mary Greeley is president of the Healthcare Leadership Council. This is a coalition of chief executives of the nation's leading healthcare companies and organizations. The Healthcare Leadership Council is an organization that advocates for consumer-centered healthcare reform, and they emphasize the value of the private sector innovation in healthcare. This is the only healthcare policy advocacy group that represents the entirety of the healthcare community, the healthcare industry. So we're extremely pleased to have Mary Greeley here with us from Washington. Mary, thank you for coming today, and I'm certainly glad you could come and be with us. Thank you. Let's welcome her.
Well, thank you, Larry, for that great introduction, and thank you, Congressman Butterfield, for all that you do, your presence here today, your very insightful remarks, but as Larry said, your advocacy on behalf of not only your constituents, but all Americans. We really appreciate it. Well, it is a real pleasure to be with all of you this afternoon and to recognize the exemplary work, the outstanding work that's being done by the North Carolina Farm Bureau and its Healthy Living for a Lifetime program. Let's get right to the point of why we're here today. And to do that, let me say just a brief word about the Healthcare Leadership Council and our Wellness Frontiers Award. HLC, as you heard, is a slightly different healthcare association in Washington, D.C. Our members are chief executive officers of many of America's leading healthcare companies and organizations. And what really makes us unique is that our members represent all the different sectors of healthcare, not just one sector of healthcare. Our members include hospitals, health insurance plans, pharmaceutical companies, medical device manufacturers, pharmacies, large distributors, and other health sectors as well. Now, our members contribute to the American healthcare system in many diverse ways, but our group is really united with a common vision of what American healthcare should be. It should be accessible, it should be affordable, it should be driven by innovation. We really see innovation as a solution to many of the problems facing our healthcare system, but also committed to constantly improving our healthcare system and constantly improving its quality. They're also dedicated and united to addressing the challenges that affect the health system sustainability that the Congressman commented on, and how we can achieve optimal healthcare outcomes. Now, I think one of the most daunting challenges that's being faced by our healthcare system today is that of the threat that's posed by chronic disease: diabetes, heart disease, pulmonary illness, cancer. The treatment of these illnesses consume about 80 cents of every healthcare dollar that's being spent today. According to the Center for Disease Control and Prevention, if we don't take preventive action now, today, then we're going to continue to see an escalation in healthcare costs and an escalation in these conditions that really will present a very severe strain on our healthcare system. So I think that phrase, preventive action, is a critical key in solving this tremendous challenge. If we can do a better job with early diagnosis, if we can do a better job with health interventions, if we can help people embrace healthier lifestyles, and if we can do a better job managing those chronic illnesses and providing better access to care, then we can begin to help people extend and improve, and I put emphasis, not just extending, but improving the quality of their lives, and I think we really can redefine our nation's healthcare future. The truth is, the best ideas for achieving these goals aren't always found in Washington, D.C. Actually, I think we see them sprouting up all over the country, from organizations that are developing innovative approaches and novel ideas to improve population health. It's one of the most exciting things that's happening in American healthcare today. These groups that are creatively paving new directions on how we can prevent disease and how we can better advance wellness of the population. So to honor such programs, the Healthcare Leadership Council created the Wellness Frontiers Award, in the belief that one of the most important things you can do with a good idea is to share that idea. It's vital that successful programs be recognized and ultimately be replicated so that we can help more people in more communities throughout the country. So that's our motivation in presenting this award. We want to shine a light on these programs that are making a difference so that they might one day make an even bigger difference throughout the country. The Healthy Living for a Lifetime program is certainly worthy of a very bright spotlight. You are doing something that is so very important, taking healthcare out of its traditional setting and actually delivering it directly to rural North Carolinians. And you're not only bringing those initial healthcare contact to a vulnerable population, but you're also carrying out some of the most important activities, the follow-ups in the form of chronic disease management, healthy living coaches, and making sure that counseling is linked with the local hospitals and local clinics for the future care of those that get their screenings done. I think your success can be measured in numbers. Larry, I've heard you say several times today, nearly 10,000 health screenings, for example. But I know that you would rather measure your impact in terms of the difference that you're making in the lives and the improved well-being and brighter futures for your fellow citizens. And we compliment you on setting such a fine example that we hope others will follow. So with that in mind, Larry, if I could ask you to step up here to the podium. And we are just delighted to present to you our Frontiers in Wellness Award from the Healthcare Leadership Council. And thank you for everything you and the North Carolina Farm Bureau have been doing with this program.
Thank you very much. You want to get over here, John?
Sure, with the mic.
Mary, thank you so much for this award, and thank you for coming down today. I accept this award on behalf of the North Carolina Farm Bureau, our board of directors, and over 500,000 Farm Bureau members all across North Carolina that made this possible, our volunteers. You know, ladies and gentlemen, it's hard to imagine that about 4 years ago, Brad Crone, and I've got to thank Brad Crone because we had the idea, and Brad's the guy that we sat down with and said, let's see if we can put some legs to this idea to make it happen. And so, Brad Crone, I thank you for your contribution to this program, for North Carolina Farm Bureau. 4 years ago, we had an idea to do this. We've been doing this program, but we're in our third year of this program, and we have screened almost 10,000 North Carolinians in those 3 years, and we have literally saved some lives. We've caught people that were in just very critical, acute situations. Had they probably not come through this trailer, they may not have made it the rest of the day. So we're certainly literally have saved lives. As I said, Warren County, this is the second time we've been here. This is the 77th screening that we've had all across North Carolina, from one corner, from Cherokee County, all the way to Carteret County, and from Northampton County to New Hanover County. We've had health screenings all over rural North Carolina. We couldn't make this work without the health community, particularly people like Andy Smith back there, who is a county health director here in Warren County. Let's give Andy a... You know, we don't just pull this trailer up in a Walmart parking lot or a parking lot and pop out this screen and go to work. It wouldn't work, ladies and gentlemen. It takes a lot of partnerships, teamwork with the health community in those counties. And I can tell you, if we go into a county where there's not cooperation and people don't want to work together, we don't come. And Warren County is certainly not one of those counties. It is an exemplary of how cooperation, how you work together and you get things done in the county. So we're proud to be here. But we have over 1,000 partnerships with in the medical community all across the state. The important thing about this, most of our counties, we don't just leave here. Our counties leave behind money to help, our county farm bureaus leave behind money to help take care of acute situations. And across the state, our county farm bureaus have left over $250,000, $250,000 in the last 3 years to help situations. This program, North Carolina Farm Bureau, our board of directors approved it. We have invested over $2.5 million to date in this Healthy Living for a Lifetime program. So we're proud of it. I thank the recognition given by the HLC. Mary, thank you for being here. We really appreciate the support of Congressman Butterfield and other members of our Congress and our public servants that are here. So thank you very much. We're proud of it, and we look forward to continuing to provide a service. You know, one of the things that we believe at North Carolina Farm Bureau is our mission from our local organizations all the way to our state organization is that of giving back. You know, anybody can take out of a community. We believe it's important to give back and to represent not only the industry of agriculture, but represent our rural communities as well. So thank you very much, and we appreciate all of you being here. Thank you.